Mohammed Sbai, today's guest, is a neuroscientist at the University of Utah who has founded a nonprofit neuro-rehabilitation facility in his home country of Morocco. The operation has grown to help hundreds of patients recover from traumatic brain injuries and strokes. He'll share insights about his work and his superpower. I'm your host, Devin Thorpe. Welcome to the Superpowers for Good show, where we empower you. Mo, thank you so much for joining me for this conversation. I'm so excited to chat with you.
Thanks, Devin. It's great to be with you again.
Oh, yeah. Mo, I'm proud to say that you and I have been friends for a decade now, and really am grateful for our long association. And it's fun to catch up because I moved from Salt Lake, where you live, so I miss my old friends there. It's been a year and a half or so. So thank you very much for taking the time to catch up. You're doing some amazing work with a project that has been a passion project of yours for the whole time I've known you, the Zahra Charity. And I wonder if you'd tell us the story, maybe really start at the beginning. And I hate to ask you to go there, but I think it just frames your work so powerfully if you share the story of your brother that really inspired the work that you do.
Absolutely. It would be my pleasure. Well, let me first say thank you very much for this opportunity. And we too here in Salt Lake City, we miss you a lot. You have been a great member of our Rotary Club and a great friend. So hope to see you soon sometime.
Thank you. We will. We will.
Like you were saying, the project we started in Morocco was triggered by a nonprofit based here in Salt Lake City that we founded back in 2009. And the project we started in Morocco, it's a neuro-rehab clinic that actually started operation in 2015. So it took us about 6 years of hard work to establish this charity. It's called the Zahra Charity, and to get the necessary resources to basically start the operation of this small but very important neuro-rehab clinic in Marrakech City, Morocco. Like you said, my background is clinical neuroscience. I'm a member of the faculty here at the medical school at the University of Utah and the College of Health. And but that was not the source of inspiration to start this project. The trigger or the inspiration to start this project was the accident that my older brother suffered in a car accident in Morocco back in 2001, and during the process of taking care of him between 2001 and 2007, when he passed away, I got to see firsthand the intricacies and the details and the hard work and the pain associated with the rehabilitations of people with severe neurological deficit like my late brother. And the other important things that this made me discover is the tragic lack of those services in Morocco. Because as a matter of fact, when he suffered the accident, the brain injury in early 2001, he was in a coma for several months. And then when he came out of the coma, we discovered that despite the fact that he has a very excellent medical insurance coverage, we discovered, unfortunately, that we couldn't get him any services locally. And so we started searching around for solutions. And my first solution was basically, as you can understand, to bring him here in the US. But the insurance refused that propositions because they said they didn't have any business partnership with any entities here in the US. So the only choice was to send him to Europe. And I did my grad school in Paris, in France. So I had a lot of contacts there. But unfortunately, after 9 months of staying there and spending a lot of insurance money, there was no progress whatsoever. And the insurance decided to basically cut him loose and send him back to Morocco. So that's when I decided to sponsor him myself and brought him to the US after overcoming some considerable challenges, including immigration issues, as you can imagine. But within that 5 years of him staying with me here in the US, that's when I got exposed to the daily dealing of recovery and going through intensive rehabilitation on a daily basis, 5 times a week. And the wonderful things that I still remember out of this process is the excellent, and I would call it miraculous, recovery that he was able to accomplish thanks to the great medical care that he received here in the US. So when he suddenly passed away in 2007, we had some discussion with him when he started recovering his speech and his memory and his walking abilities and all that stuff. We had a few discussion about what we can do to help patients like him in Morocco who are not as lucky as him. And he's a very kind person. He was a very kind person and great guy. And he was always, when we start this kind of discussion, his eyes always light up with excitement, as he was determined to offer whatever it's possible to other patients in Morocco who are not lucky to have the necessary care and neurological rehabilitation services. So when he passed away suddenly, 2007, I just felt the burden that I need to do something about it, honor those discussions and honor his legacy. And to be honest with you, I had no clue what was the plan and what to do and how to do it. But the first thing that came to my mind is to set up a nonprofit and see what happened. And that's exactly what we did. Like I told you, we initiated the process in 2008, and the nonprofit was approved in 2009. We named it after my mom because my mom played a huge role in his recovery when she joined us in the US and spent the last 2 years of his stay here with us, and played a tremendous role in coordinating his therapy and basically just keeping the hope alive and encouraging us both, especially him. And once we got this charity up and running, then there was the great work of setting up goals. What are we going to do with this nonprofit, and how are we going to get the resources to be able to accomplish those goals? And like I said, I didn't know anything in the process. So I got a lot of friends like you from Rotary and then from the University of Utah and some other places, and everybody pitched their own contributions and their own suggestions. And like I said, by 2015, we were able to train a bunch of therapists on the American know-how in rehabilitation protocols, and we were able to purchase some used medical equipment, and that's how we started the clinic in September 1st, 2015.
Wow. And what you have done so far is pretty remarkable. You now have a staff of 12 working in this clinic in Morocco. It's very modern, up to date with the very latest technologies and therapies going on. So you're really making a difference already for a lot of people. How many people have you treated, do you think, since 2015?
I would say we're close to 400, 370 something total. it's a small facility. The space that we have now, it's about 2,700 square feet. So it's not very big. At the peak of operation before COVID, we were treating about 50 patients a day.
Wow.
But those are recurrent patients.
Yeah.
Those are patients who are in the system for long-term therapy. But the one that we helped and we discharged, I think they are about 370 something total.
Wow. That's great. It's inspiring to learn what you've done. Now, you're doing a major fundraising campaign now to take this to a whole new level. Tell us about what you're trying to accomplish with this expansion effort, and tell us about your funding requirements.
Yeah, so by the year 2017, which is like 2 years after we started operation, we started noticing some influx of patients after the clinic made its name and earned some respect in the medical communities. Because in the beginning, when we started, nobody knew who we are and what we are doing. And the people who knew what we are trying to accomplish, they were very skeptical because, as you can imagine, a place or country where you don't have neurological rehabilitation facilities and services, for the majority of the people, when you have a neurological deficit, whether it's you're born with it or after an accident or injury, basically you're doomed. There's no help for improvement or recovery. But thanks to the training that we did for our therapists, that was sponsored by Rotary, they were able to show some really good results very quickly. So by 2017, we start getting people, because of the space limitation, we start getting an increasing number of people in the waiting list, which caused us a lot of stress, if you can imagine, because we want to help everyone, by nature, we want to help everyone, but unfortunately, our hand we're tied because of space limitation. So since then, we started thinking about how we can actually grow this project and make it accessible to a much bigger number of patients. And the idea we came up with was to basically find a property where we can build our own building, so that the facility wouldn't cost us monthly rent. Right now, they're paying we start paying about $2,500 a month. Now we're paying about $1,800 a month, which is a lot of money for them. And by having our own property, we can not only save on rent, but we can also design the facility as we would like it to be. Like, for example, the current situations where we are right now, it's a combined space that basically treats children and adults in the same place, which is not ideal because, children, little kids, sometimes they come into the clinic not in a good mood and they start crying and making noise, and for other patients, that's not ideal. So that's one of the things we would like to accomplish, is to have much bigger space with separated units, one for pediatric and one for adults rehabilitation. And as far as so we have two stages for this, or we have two stages in this plan: long-term and then mid-term. Long-term is basically a very ambitious project that include what I would call an entire campus that has the main, or the principal, or the main facility will be pediatric adults neuro-rehabilitation, surrounded by small other units that specialize in other medical specialties related to neurorehab, like cardiology, radiology, neurosurgery, and so forth. So that's, I call it a campus, a medical campus. That's very ambitious, and it will probably require at least $10 million of funding to be set up. The short-term or mid-term goal is basically to prepare the ground for that campus, which is basically, if you want to build a campus, you have to secure the land. And so we are trying to get a 10-acre property that already have pre-existing building of 10,000 square feet, and with some remodeling, we can transform it into a 20,000 square feet building. So that should give us plenty of space to grow for several years while we are preparing for the more ambitious plan, which is building the campus. And this short-term or mid-term project is requiring a budget of $1.8 million, money to buy the building and the land, of course.
Yeah, fantastic. So this is really an exciting thing to envision because of the tremendous impact this is having in Morocco. I mean, it just is truly astounding and exciting to think about. That in 2010 there was nothing going on, and now you've created this tremendous resource that is changing so many lives. Because what you've shown, and let's recap a key point. One of the things you do at your research at the University of Utah, and you've shown over and over again with the therapy you're providing, is that people can make dramatic improvements and return to living very fulfilling lives after a traumatic brain injury and after a stroke too, right? You treat some stroke patients, right? So amazing stuff.
We treat kids, a lot of kids. As a matter of fact, the patient population we have now, it's about 60 to 65% children. And the tragic things going on with children over there is that maternal health is not very adequate. So a lot of babies are supposed to be born healthy, but unfortunately, during the last few weeks or the last few days of pregnancy, something happened that actually caused damage to the brain of the stillborn baby, or sometimes during the delivery itself, the baby is not properly resuscitated, and then it only takes a minute or two of suffocations for the damage, hypoxic damage to happen in the brain, and that leave the infant with the condition called cerebral palsy that has a variety of symptoms and degrees of severity. Some of them they can't speak, some of them they can't walk, some of them they are completely disabled, some of them they are slightly affected in their development. So we treat a lot of those kids. Obviously, there is also stroke in these kids populations that happen during pregnancy or shortly after the delivery. And like you said, in the adults populations, we are dealing with traumatic brain injury, spinal cord injury, stroke, a lot of neurodegenerative diseases like MS, Parkinson, Alzheimer, brain cancer, and so forth.
Yeah. Well, it's amazing work you're doing.
Thank you.
And you're really an inspiration, Mo. As you think about what you've been able to accomplish over the last 20 years now, what do you see as your superpower?
Superpower would be just doing your best to help people in need. In our particular cases, we assembled these resources and this expertise in clinical neuroscience and neurological rehabilitation. And we are really blessed to be here in this great country where we have a lot of resources and access to a lot of resources, whether it's expertise or training or educational in the medical field. And I feel blessed and lucky to be in this position, so I can transfer at least some of these resources back to Morocco. And the other ambition that we have is once we have good working model in Morocco, we would like to share it with other African countries as well.
Yeah. As you think about leveraging this concept of doing your best, I think the Zahra Charity and the clinic in Morocco is a great manifestation of how that superpower comes into play, right? You have just leaned into this superpower of just doing your best, whatever that is, and what you've seen is amazing things happen. If you were trying to coach a friend or a colleague to step up and do their best, how would you coach them to do that? It's sort of almost tried on the one hand, and yet the power of that is enormous. How would you coach someone to do it?
I would say just believe in what you're trying to do, and don't give up, because this kind of work is not easy. Because if it was easy, everyone will be doing it. So it's very challenging. And like I said, in my case, I had no expertise in nonprofit. I didn't know what to do as far as nonprofit work, and how to raise fund, or how to bring in the useful contributions from other people in the community. So you just have to go for it, so to speak. Go for it and be persistent. I think consistency is probably the most important things in every process like this one. I mean, it's good to have a good idea that is beneficial, that is a humanitarian. It's also good to have a good start, if you are lucky to have a good start and make a first impact. But the most important is to be persistent, because if you have a good impact and it doesn't end well, then all of those efforts are in vain. But if you are persistent, then those, even if you start very small, those initial efforts and accomplishments will only grow with time, and became a kind of infectious and then bring you more and more positive energy into the process.
Yeah, that's powerful. Well, Mo, thank you so much for taking the time to be with us today. As we wrap up, I wonder if you'd take just a minute and tell people how they can learn more about Zahra Charity and how they might be able to contribute to the effort to your success.
Yeah, so we have two very small websites where we can guide them for more information. The Zahra Charity website is zahracharity.org. And then the clinic, the neuro-rehab clinic, it's called MAIR. So MAIR -rehab.com. And they can find link to our fundraising efforts in both websites. Although I learned this morning that the person in charge of updating those websites, they're still working on them. So if there is some information that's not accessible or not complete, just be patient. I'm guessing in a week or so, both of them, they will be fully updated.
Great. By the time that we get this out, then they should be current, because this will probably run in late May or early June. So
Okay.
they should be all current by then. But Mo, thank you so much for taking the time to be with us today. It's just a thrill to catch up and what you have done. I've been able to observe as a friend, as a Rotary colleague, the progress on this project over the last decade, and it is truly an inspiration to see this go from really an idea stage project to a fully realized and now rapidly expanding project that impacts countless people. So you're an inspiration. We're grateful for the work you're doing, and we wish you every success in bringing your vision into full reality.
Thanks, Devin. Thanks for your time, and thanks for the opportunity, and thanks for being a good friend. So I hope to see you soon in Salt Lake City.
Thank you. Thank you. Now, let's do some
Thank you.
good. Thank you for tuning in to the Superpowers for Good show. Twice each week, we host changemakers who share their impact, insights, and superpowers. Don't miss another episode. Subscribe today at superpowersforgood.com. That's superpowers good.com. Be super empowered. Get your copy of the book, Superpowers for Good, as an ebook, audiobook, paperback, or hardcover edition via your favorite online retailer. Interested in having me speak to your company, organization, or association? Visit devinthorpe.com. Then let's talk. Now, keep using your superpowers for good. Together, we can reverse climate change, improve global health, and eradicate poverty.